or you divide your contract. All right, do we have everybody here that we need to have here?
I believe so, Mr. Chair. I think we have 4 board members and 2 had reported that they would be absent.
Okay, that's what I'm counting too. So then I'd like to go ahead and call this meeting of Health and Human Services Board together or to order on Thursday, April 14th at 10:31 a.m. We have a 17-point agenda. There'd be a motion to approve our agenda.
So moved.
Motion by Timothy Gotchel and seconded by Cindy Chicker. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. I guess Director Fullerton, was this meeting properly posted?
Yes, it was, Mr. Chair.
Wonderful. Then we'll move on to agenda item number 2, which is approve our March 10th, 2022 Health and Human Services Board minutes. Are there any additions or corrections to those minutes? There are none. I guess I would accept a motion to approve those minutes from March 10th. So motion from Cindy, is there a second?
Second.
Seconded by Dr. Barris. Any further discussion on those minutes? Hearing none, all those in favor signify by saying aye.
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 Aye. Those opposed say nay. Motion carries. Agenda item number 3, citizen comments. Are there any citizen comments? Are there any citizen comments? Anybody written anything and sent to Director Thorson?
No, Mr. Chair.
Okay, we'll move on to agenda item number 4, director's report.
All right, thank you, Mr. Chair. So I guess as the board knows by now that I will be leaving my position here at Richland County. You all would have been copied on my resignation email to the county administrator. When I came back to Health and Human Services 3.5 years ago, I was really hoping to retire from the same place where I started my career some 33 years ago. And unfortunately, just as I've gotten older and my long commute has gotten more difficult for me, I found it necessary to really look for some other options for myself. I'm going to be leaving to go to Monroe County to serve as the Human Services Director there, and my last day here will be May 19th. The Health and Human Services Director position is currently being advertised and will close on April 27th. The county administrator is overseeing the application process. He will also appoint an interim director, possibly as early as next week, to assure that the agency can operate with all of the things that it needs to do in as little disruption as possible until a new director is in place. I'll work with the interim director and our leadership team here to assure that the programs and services continue and our operations are not interrupted. Health and Human Services is fortunately in a good place organizationally and financially, despite our concerning staffing crisis. And I'll offer whatever support I can to assure the successful transition to a new director. I just want to say that, you know, the Health and Human Services really does have an excellent leadership team and a tremendously dedicated staff. I feel extremely fortunate to have worked with them. And with this supportive board, I greatly appreciate the board's commitment to the department and your understanding of the important work that's done here. So thank you for that. There's not really an easy way to segue from what I've just talked about, but I would like to talk about some of our program highlights. Children and Youth Services continues to function with a shortage of staff. We've added an LTE family preservation position to help with covering increased visitations, parenting support, and continued outreach to at-risk families. With the COVID numbers continuing to be lower, we have plans on putting into place some small group sessions of our youth empowerment services or YES program for this summer. The YES program works with youth to complete community service hours, work towards development of community connections, and development of independent living skills. This group is facilitated by Eric Ives, our youth aids worker. For behavioral health, consumers of the Comprehensive Community Services or CCS program will work with the UW Extension Office to help support the community gardens over the summer this year. Outpatient substance abuse treatment staff will be implementing the DHS 75 changes that will go into effect on October 1st. DH 75 is the administrative rule that regulates substance abuse treatment program services. There's going to be several changes being implemented, including decreased wait times from the initial referral for services to contact with the individual, and increased education for those who are addicted to opioids. Birth to 3 service providers will be participating in a Child Find event this week at Ithaca schools. Child Find is a process for public awareness activities, screening, and evaluation designed to locate, identify, and refer as early as possible all young children with disabilities and their families who may be in need of early intervention program services. Child Find information was also recently shared with Kickapoo and Richland schools. With economic support, Healthcare renewals that are scheduled for May 2022 have now been postponed by 3 months to August of 2022. And there's still no word on the end date of the temporary COVID-19 policies for healthcare benefits. And this month, the Economic Support Unit will have its first in-person staff meeting since the start of COVID. Since the pandemic began, about half of the economic support staff work remotely 100% of the time, and the remaining staff work in the office 100% of the time. We allow those staff to choose remote work or in-office work, but it needs to be one or the other because of the technology equipment needs. So that means that we have some staff who haven't worked in the building for about 2 years. We know that in-person meetings play an important role in staff engagement and development, so we're excited to have everyone back together to conduct periodic team trainings. And with the ADRC, as part of the ADRC's involvement in the Richland County Care Coalition, we are working on creating an event for this summer aimed at addressing the caregiver shortage in Richland County. Currently, the plan is that a job fair style event will be held with booths of local providers and presentations. The ADRC is having its annual spring volunteer appreciation luncheon and training on April 26th. Our volunteers drove a combined 134,928 miles and provided 6,180 hours of service in 2021. Without these dedicated volunteers, we would not be able to provide the high level of transportation services in our community. This luncheon gives us a chance to recognize all of their contributions to the community and also provides training and program updates to the drivers. Drivers are excited for this since it will be our first in-person meeting and appreciation luncheon since 2019. The regional dementia care specialist and ADRC staff will be providing dementia training to local banks in the community. The programming will provide hands-on experience to bank staff so that they understand what an individual with dementia may be experiencing, and will provide training on how to work with someone with dementia. And then related to public health and nutrition, we do not have a separate health officers report today. Going forward, highlights from public health and nutrition will be included in the director's report, but special health officer reports will be provided to the board when there's an occasion to do so. So as we do every month, we did include our COVID-19 data sheet in your board materials. We're fortunate to continue to see low COVID case numbers for Richland County and across the state. Public health staff are focusing on administering vaccines, especially second Pfizer boosters, and they also continue to assist with the community testing site. Public health staff are also pivoting to provide many of those other public health community-based services that have had to be on a near hiatus status since the pandemic began. Some of these services include the provision of other immunizations and TB prevention and control activities, just to name a couple. Our nutrition program continues to offer meals in person via the grab and go format and through home delivery. A volunteer recognition event is also being planned for May, the first such in 2 years. Volunteers are welcomed and are being actively recruited as we need more volunteers in our nutrition program. And that's my report, Mr. Chair.
Any questions for Director Thorson? Hearing none, thank you, Tracy, for your report. Guess we'll move on to agenda item number 5, which is our expenditure report, vouchers and expenditures that are over $2,000 but less than $10,000.
And I'm going to take that today for Stephanie. So let me get, oops, I can't get to that. There we go. She prepped some notes for me to review for you guys. All right, so we're looking at the 55 vouchers, $36,894.17. And let's see, the first few pages, as always, are the mileage expenses. And when the vouchers actually start on page 3, so when you get to those, right at the top, the third one down, number 57, is our snow plowing and salting. Hopefully that's for the end of the season. So that should be the last voucher for that service, at least until maybe December. But then we start number 11. Starts all of the client services. So you see at the top is credit card charges. So that actually starts on this page and goes to the top of page 5. Lots of individual charges this month. On page 3, in particular, Steph wanted me to point out a number 74 and 76. Those are for language line charges specifically tied to a sign language translator service. And item number 6 was for the purchase of incentive items for treatment court. On page 4, number 20, she has a purchase of compartment trays for the nutrition program. And then items number 70, 75, and 65 were additional sign language charges. Okay, then the bottom of page 5, she has highlighted CDW charges. Those were various computer supplies needed, privacy screens, computer monitors, and such. On page 6, right at the top, is a reimbursement to Brady Donahoe. She is a child and youth services worker, and she had to purchase some formula bottles, blankets, car seats, etc., to assist families when that need arises. So we're just reimbursing her for those purchases. Number 24 and 25 is our copier leasing, our monthly charges for those. She also highlighted number 26, which is the $992. That was for the purchase of birth to 3 home visit summary forms. And on the same page, she also highlighted number 27, additional language line services, but this is actually for translation. So whether calls were received that she needed to translate for Spanish or some other language. Page 7, right in the middle, she has number 31 highlighted for positive promotions. That was to purchase thank you gifts for our volunteer drivers. Then she jumped to page 8, just about in the middle as well. Number 53 is Summit Fire Protection. Those expenses were for inspection of the fire extinguishers and those on the buses as well as in our building. It's kind of annual inspection. Page 9, number 47. This one's kind of large, and this is for several individuals, 9 total, that work with the treatment court program. They're attending a conference for the team, and this training will be built into the treatment grant and is covered by the grant funds. And we're at the end of all the regular vouchers, and the previously paid are listed as well. So everything has been approved by the county administrator, and previously paid are largely just to prevent late fees. That's what she wanted me to note as well again. So And I think we've come to the end. Any questions for the vouchers?
All right, here are no questions or concerns with our vouchers. Let's move on to agenda item number 6, our 2022 budget summary and Richland County placement report.
All right, I will take that, Mr. Chair. So as you can see here, I'm showing the actual expenses for Health and Human Services. So this report covers the first 3 months of 2022. So you would expect expenses on this far left table to be at 25%. So anything less than about 20% would be notable. So with admin services, everything appears to be pretty much on track. Under public health, so during COVID, we've been seeing public health expenses run higher than normal. But here you see that the public health and nutrition expenses are in line with the first 3 months. This is primarily because there are still some expenses coming in from March. And our staff contact tracing activities have diminished substantially in March. So we're seeing a lot lower expenses that way as well. In the ADRC, elderly services expenses were low in January, which impacts the 3-month total. Child and youth services, excuse me, I skipped over economic support, is in line with what we'd expect for 3 months, right around 24%. Child and youth services are significantly below the 25%, and this is driven by the significant staff vacancies in the unit, as well as some of the contractual services just have not been utilized yet. For behavioral health, low expenses that you see here are primarily due to delays in contracted providers submitting the service invoices, as well as some of the training budgets not yet being utilized. For adult protective services, we have virtually no expenses. You can see that's at 2.2%. And this is primarily because the APS worker position and that half position, the APS crisis position, have remained unfilled for the first part of the year. Our other behavioral health staff are covering adult protective services through the crisis program. And then treatment court expenses are low because the budgeted contract services have not yet been utilized. So those are still in the budget there. So we're showing at about 16.5%. And birth to 3 and children with disabilities expenses are pretty much on track. So then I will move to the middle table. So you'll see that after we calculate our received and anticipated revenues, along with the anticipated expenses that we haven't received and were not included in the previous expense table, our budget is pretty much on track. We show a negative $3,123 before the mental health institutional chargeback to the placement fund occurs, and we show 5,511 to the good after the chargeback occurs. Are there any questions about the budget report before I move on to the placement report? All right, I'll just move along. So for placements, just a reminder that we're only showing 2 months of placement information, and that's because some of our expense information is still coming in for March. So with adult placements or Fund 54, we had still some inpatient or institutional placements and one adult crisis stabilization placements. So our total for the first 2 months of crisis stabilization is $11,250. The total for the first 2 months for adult institutional and inpatient services is $46,181. I'll scroll down to our adult residential placements. We continue with 8 individuals receiving those community residential placements for a total of $13,288 for the first 2 months. That is significantly lower than you might have noticed if you compared it with last year. And part of that is because we are trying to utilize CCS reimbursements as much as possible to fund those placements. So in Fund 54, which is the adult placement fund, we start the year with $785,000 in tax levy. We have a total expense applied to that fund of $70,718. So currently remaining in that fund is $714,282. Then I will go on to the child placements or Fund 44. We continue with that longer term child institutional placement, and we did not have any detention costs for the first 2 months of the year. So we have a total of $48,302 in child institutional expenses and 0 with detention expenses. And then with child foster care and treatment foster care placements, the year-to-date total for group home and treatment foster care is $77,192. And the total for regular foster care is $7,205. So in Fund 44, or the Children's Placement Fund, we start the year with $700,000 in tax levy to fund those services. We have a total expense for the first 2 months of $132,699, leaving $567,301 in that fund. And I will show you, I added the usual other reports that we provide you, but I'll caution you that with only 2 months of data, any of our year-end projections probably are not terribly realistic because we just don't have enough information to show that. So this report shows annual days of stay by placement type, with dark blue being the 2022 year to date. So those are actual days in those placement types comparing to the previous years. And then as I scroll down to the expense history by placement type, you'll note that there's a 2022 year-end projection. So that is projecting if placements continue just like the first 2 months of the year, this is where we would expect to end up at the end of the year. So just for an example, adult institutional inpatient, which was a little lower for the first 2 months of the year, we would expect that to end the year at $277,085. Now again, these projections aren't that relevant yet with only 2 months of expense data. So I'll caution you not to expect us to end there. When we have a couple more months of data, it's a little easier to rely on what those trends are looking like. And then I'm going to skip over to the next report that we provided you. So this is a comparison of annual placement expenses and budgeted tax levy. And you'll see again, there's a year-end projection for 2022, which probably I'm just repeating myself quite a bit, which I don't think is horribly relevant yet, but as we get into the year, this projection becomes a little bit better picture of what we'd expect the placements to end up as. And I'll note that this year, from the budget that was created by the county administrator and the county board. More tax levy was put into the 2 placement funds totaling $1,485,000. That was done with an effort to more realistically budget for placements. So I'm feeling really optimistic about how placements are really fully funded, and hopefully, like we did last year, we may end up a little under that amount that was set aside. So again, in the first 2 months, just with that, if placements continued in the same vein, we would end the year at 1.2 million approximately. And then this final table just kind of shows you what monthly placement expenses have looked like, with dark blue showing the 2022. So there's only 2 months of placement expenses. And when you see the dark blue compared to the other years, you can see that we are a little bit lower in our expenses for the first 2 months of the year. Does anybody have any questions about the placements?
Yeah, Tracy, can you tell me again the difference between placement with the crisis intervention versus the institutional? Where are
Sure.
they placed, crisis intervention?
Crisis intervention is crisis stabilization services. So it's a non-hospital setting. And we utilize Tolarian Care Center. They have a center in Madison and one in La Crosse. And so it's more of a residential type setting where someone can go and get 24-hour monitoring for their safety and get some assistance with crisis intervention and sometimes even medication management. So that is a way, it's a way to keep the person more community-based. It's certainly less costly than putting somebody into like Winnebago or inpatient setting. So if they don't need that inpatient setting and there's space available, then we're able to use crisis stabilization as an alternative to putting somebody in the institution or the hospital.
So are these people staying at home and then commuting to Tolarian?
No, they would be staying there overnight, 24-hour monitoring. So this would be a level of care that they require to be someplace safe, but they don't necessarily need a hospital level of care for safety.
So that's not considered inpatient, even though they're there.
Correct. It's really not a hospital setting. They don't have physicians or nursing staff. They have trained crisis staff who monitor and provide services to them.
Okay.
Are there any other questions for Tracy? So I assume that you were done then with your placement report, correct?
Yes, Mr. Chair.
Okay. Then let's move on to number 7, our 2022 contract monitoring report.
Okay, and that's me again, and there it is. Okay, so these are contracts for 2022. Looking at February is the approximate utilization month of 17%, then is what we're looking for on the far right. Anything that's over that. Some like I usually note right at the top there, I see where the cursor is at, Children's Hospital Wisconsin, that is over the 17%, but they've already invoiced us through March. So that should be higher, as well as right below that, Cholita also invoiced us through March. A little further down, Forward Home for Boys, once again, over the 17%, but they've invoiced us through March. So flipping to page 2. Third from the top is CISA 3. That is well over the 17%, and I've only seen bills through February. So I will have to talk to Lori and see what's going on there with that contract provider. That's going to trend higher. That was the only other one on page 2. I didn't see any issues with page 3. Page 4. About 5 up from the bottom, the Jessica Leinberger counseling is over the 17%, and she's only billed us through February. So another one, again, I'll have to work with Miranda and see where things are at, if they're trending higher for her. Right below her is Cario, That's one of those, though, that is billed us invoiced through March. Some concerns there. Page 5. 4 down, Northwest Counseling and Guidance Clinic is just a little over the 17%. So not too worried about that right now, but we'll see if it continues to trend higher. And 3 up from the bottom is Shea Rehabilitation. Definitely looking over 17%, trending higher, and they've only invoiced us through February. So that might be another one that they're utilizing more, but we'll see as that the year goes on. And page 6, and no issues there on page 6. Any questions on the contract monitoring this month?
All right, no questions for our contract monitoring. Thank you, Angie, for giving that report. Let's go on to agenda item number 8, approve our contracts, agreements, and amendments.
So we just have one this month. And there it is. Not sure if I'm pronouncing this right. Miranda Satori House is a new provider in Baraboo. Miranda, if you want to, I think I saw Miranda on earlier.
Yeah, I'm here. So Satori House, along with one other provider in the community, are able to provide peer support services to individuals diagnosed with substance use disorders. So Satori House works through a state-funded ED2 recovery grant for individuals struggling with opioid addiction and stimulant use disorder addiction. And then, so there's that contract. Really, the $1,000 is for training. They are funded through a separate grant to come in and provide those services in Richland County, but we agreed through another opioid grant to go ahead and cover the training costs through there and got that approved with DHS.
And
This
that's the
was
only-
covered by the opioid grant, correct?
That's correct.
Okay. So then we would need a motion for approval, correct? So I would entertain a motion to approve the Satori House for $1,000, the opioid grant. Anyone willing to make that motion?
So moved.
So motion by Timothy Gotchel. Is there a second?
Second.
Seconded by Dr. Barris. Any further discussion? Hearing no discussion, all those in favor signify by saying aye.
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 Aye. Those opposed say nay. Motion carries. Next on our agenda is agenda item number 9, personnel updates.
Right, Mr. Chair, all of the board members should have the memo from Angie that kind of summarize all of our updates. I'm just gonna kind of give you the highlights, so I may be jumping around a little bit on that memo. Of new hires for Health and Human Services, we have Alice Lawrence Rettram, psychiatric nurse, returning. You might remember her name, that she had been working here before and has decided to come back. She started on the 4th of April. Lisa Kratchy, how am I doing, Angie? I'm not sure. We've been able to hire adult protective services worker, which we're very happy about. Lisa will start on the 25th. And then Alicia Woodhouse is the LTE family preservation worker that we've hired, and Alicia will start on the 19th. And then I will note that Allison Barger, our mental health therapist, has successfully completed her probationary time, will be as of the 18th of April. And then with resignations, certainly I've talked about mine. And Teresa Richards, an LTE public health nurse, has resigned from that limited term position as of the 20th of March. And Diane Cox, our LTE APS worker, will be finished on the 29th of April. And then in terms of positions that we are currently attempting to recruit, I mentioned the director position that the county administrator is overseeing. And then we are still trying to recruit a CCS supervisor, that APS crisis professional, mental health therapist, and 3 child and youth services case manager positions. We have done some interviewing, so we'll kind of wait and see what happens with that. All other positions, so I believe that's 6 positions plus the director position that are currently vacant. And then any other positions that are on our Health and Human Services schedule for positions are currently on hold because they weren't included in the budget. And that's all, Mr. Chair.
Thank you for that report. Agenda item number 10 is approve the use of 2021 Health and Human Services remaining funds.
All right. So this agenda item is a follow-up to a statement that was made at last month's board meeting, I believe by Supervisor Gottschall, about possibly the board taking some action on keeping the 2021 surplus funds with Health and Human Services in order to address our staffing and recruitment, and retention crisis, rather than returning those funds back to the general fund. So I said that I would include this as an action item on the agenda so that the board could decide if you wanted to vote on a recommendation for what to do with these remaining funds from 2021. And so the board summary sheet that you have here, what I did was I tried to capture some of the conversation from last month's discussion of these remaining funds. And so what I have here as a potential action that the board could consider taking is advising the county administrator and the Finance and Personnel Committee that those remaining funds from the 2021 Health and Human Services budget, because they come from sources that are intended to be utilized to fund human services programs, services, and operations, that they should be applied to address the Health and Human Services staffing crisis. So along with that the board could consider making a recommendation that barring any action that the county board would take in 2022 to establish a wage placement progression plan and to address the high cost of insurance, that rather than returning the remaining funds from the 2021 Health and Human Services budget to the county's general fund, that these funds should be used instead to address the retention efforts in the department by providing both retention bonuses to existing staff as well as sign-on or incentive bonuses in order to recruit for vacancies. Mr. Chair, that I don't want to put words into the board's mouths, but I guess I just wanted to try to formulate something that you would be able to discuss. In this summary, I included just the background of our issues with the staffing crisis, showing the major difficulties in 2021 with the loss of 18 of our staff, and that we have lost 2 additional staff in the first months of 2022. And now our biggest struggle seems to be recruiting for those vacancies and maintaining our staff, of course. So I had in the summary 7 positions remain unfilled. With my position, that would probably ring true, but I, at the time that I did this, we had not hired that APS position. So this should probably read 6 remain unfilled. And they're in critical areas, including 3 in the area of child protective services and 5 in mental health and crisis services. And I added to the summary just recognizing that being unable to fill these critical positions places significant stress on our remaining staff who have to take on those additional duties. Long-term stress like this will predictably lead to burnout and could potentially put the agency at risk of losing more of our staff, or putting those remaining staff at risk of being susceptible to errors in judgment in those critical emergency services like child protective and adult protective services and mental health crisis. The summary goes on to show what we showed you last month is kind of where those remaining funds come from. And then, so that totals to about $656,000, a little bit more than that. And then after our projected placement expenses are covered, that deficit that we have in the placement funds of around $200,000, there would be $452,373 remaining that would end up being carried over from 2021. So that's just an overview of the summary, Mr. Chair.
Thank you, Tracy. You heard the explanation. What are the committee's wishes? We want to move this on to finance and personnel before it goes to county board, correct? There,
Mr. Chair,
go ahead, Tim.
Tracy, would you mind pulling that back up just so
You bet.
I can reference it? I did have a couple, all in all, it looks great. I think it's a nice consolidation of at least what I am feeling. So I think the intent here is really good and something I could get behind. A couple, so 7 positions remain unfilled. I know we had a little narrative on that. 3 in child services and 5 in mental health. That's 8. Should
Oh.
we?
Thank you for that. I'm not sure what happened with my math. I'll check that.
Okay. And then if we could scroll down to where you kind of have the itemized savings. Yeah, right there. So full disclosure, I would be in favor of all surplus coming back to the department. I think maybe Carrie, you can back me up a little bit here. I think that is probably going to be a non-starter in finance and personnel to take the full amount. But I think a strong case could be made for items 4, 5, and 6, which could be really specifically earmarked for mitigation efforts for operations and personnel retention during the pandemic and otherwise, actually, to bolster operations in HHS. So I would propose an amendment, and I just want to double check my math real quick here. Yeah, so the aggregate of those bottom 3 lines would be $147,347. I would propose amending this with a narrative to be a little more intentional, to say that our recommendation is to retain that $147,347 for it. That's perfect. I mean, what's listed there: retention efforts, retention bonuses for existing staff, and sign-on and incentive bonuses. I wouldn't change that at all. But I would like to see that specific amount inserted somewhere where it makes sense before we forwarded that on. So I would make a motion for that amendment to this.
So we have a motion to amend this current proposal that Tracy brought forward by Timothy Gotchel. And the motion is for, out of the 470 some thousand, is that number? I don't mind.
Yeah, it would be 452,373.
So out of the 452, 373, Supervisor Gotchel is making a motion to have 147,000 of those dollars, correct? Roughly?
Correct. Yep.
To stay with Health and Human Services, and the remainder you would say could go back to the county, correct? To the general fund?
That's my proposal. Yes.
Okay. Megan, do you got that written down at all? Could you read that back to me for what the amended motion is? I believe you're muted.
Okay. So I do have a motion by Tim to approve the retention of the 147,347 from the 2021 Health and Human Services budget to be utilized for, sorry, one second. The provision of retention bonuses to existing staff as well as a incentive bonuses in order to recruit vacant positions. Is that what you meant?
I had a bit of a hard time hearing you, Megan. Sorry. I think it was right, but I missed a little bit.
Mr. Chair,
Go ahead, Tracy.
I'm wondering if Supervisor Gotchel, if what we did was take this paragraph here and where it says rather than returning the remaining funds, that we could insert to the general fund that 147,347 of those funds would be, I guess I thought I had it, but I guess I don't. I just thought that there might be a way to insert it into the existing paragraph to insert that amount. But maybe I don't have it. And I know that Megan has it.
Okay, so we have the amended motion that was stated. Is there a second on the amendment? On Mr. Gotchel's amended motion?
I will second.
We got a motion and a second. Is there any further discussion? Okay, so we're going to be voting on the amendment. So all those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. So now we have an amended motion. So now could we read what the actual resolution would be that would be brought forward to finance and personnel? We can kind of cobble something up together, I guess.
Mr. Chair,
Go ahead.
that what Tracy last mentioned was exactly what I had in mind. So like
Okay.
where the cursor is on these right now. So it's general fund, comma, $147,347 of these funds should be used instead, etc.
Okay. So now we have the motion to insert 147,000 into that second paragraph where these funds are at. I think we're clear on that. So do we have a motion now to approve the amended motion?
So moved.
Motion by Timothy Goschel. Is there a second?
I will second.
Seconded by Cindy. Is there any further discussion on the motion at hand? Hearing none, all those in favor signify by saying aye.
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 Aye. Those opposed say nay. Okay, motion carries.
Mr. Chair, one point of clarification. Do we know when this will be going to finance and personnel? I would like to make sure that I attend.
I am not sure when it will probably go there. I I think it'll probably go be on Clint's desk, and then whenever the new hour this is gonna work out, probably take it up at their convenience probably, so.
Okay.
I assume it would be within the next month or two.
I didn't know if you knew if the finance committee was meeting prior to the new session or not.
I don't think they are.
Okay, thank you.
Mr. Chair, I have a question as well.
Go ahead, Cindy.
Depending on, I guess, it said to retention bonuses. Would retention bonuses only be provided to those staff who are still working with the department at HHS, or with those who have, or to those who recently left as well? I guess at what point in time would they be applied?
Mhm.
Or is there a plan for that?
So what you're asking, Cindy, is that would some of that bonuses be in effect for some of the employees that may be resigning in the future, like that have already submitted resignations?
Right, right.
Yep,
It's
Um,
all timing.
yeah. I guess I wouldn't know that. That would be up to finance and personnel and the county board to make that final decision on when and how those would be distributed, if they so choose to go along with what our proposal
Right.
is.
Right. Thank you.
Yep. Any other questions on agenda item number 10? Okay, we're gonna move on to 11, approve bonuses and resignation personnel who made a significant contributions to the public health emergency response to the community during the COVID-19 pandemic.
Mr. Chair, the board voted on that last one, right? That was approved, correct?
For the approval of the use of the 2021.
I see
Yep,
Megan
they
shaking
did.
her head. I kind of got lost in that. All right, so I guess I do want to point out that this is a completely separate from the previous agenda item. They seem similar, so I just do want to make sure that that's clear. So this proposal is intended to recognize that significant public health contribution that many staff from the county made to assist the community through the pandemic. So as the board knows, this was an unprecedented event in recent history of local public health agencies, and was much like being deployed in a military sense for many of our public health and emergency staff. So our public health staff and many other county staff put their daily work responsibilities on hold to be reassigned in order to participate in the response to protect the community by providing those testing services, disease investigations, vaccine clinics, and other support activities for the community. So on this summary sheet, what I wanted to really emphasize was that certainly all staff in the county went above and beyond to maintain their essential services to the county. And what we're talking about here is those staff who responded to provide the public health intervention during the pandemic for the community. So the proposed motion would be to approve an expenditure of $44,500 by utilizing a combination of Division of Public Health COVID-19 funding allocation and or the ARPA funds to provide bonuses and commendation plaques for recognition of 33 personnel who made significant contributions to the public health emergency response to the community during the COVID-19 pandemic, as well as to formally recognize the contributions of these individuals in a county board resolution and forward these recommendations on to the Finance and Personnel Committee and then to the county board for approval. So as I said, and as the board knows, especially being a board of health, which I guess this proposal is being brought to you kind of more in that role than any role, that once the emergency disaster proclamation was issued by the county administrator, over the last 2 years, numerous county personnel put their daily responsibilities on hold and were reassigned in order to participate in that response to the public health emergency. Some duties required our staff to don full personal protective equipment to protect against the risk of contracting the virus or bringing it back to their families. Working at testing events and vaccine clinics. Many worked in outdoor inclement weather conditions at the testing sites. Others regularly worked extra hours during evenings and on weekends, above and beyond their regular 40 hours, providing disease investigations or performing other needed support activities to assist in the community response. Several also participated in the Emergency Operations Center meetings and regularly advised and provided information to community members and organizations like our school districts and businesses to help them keep safe. 33 Richland County personnel have been identified who made these significant contributions during the pandemic. So now the pandemic does appear to be winding down with significantly fewer cases, knock on wood. The Department of Health Services is conducting their COVID-19 Thank You Moving Forward Together campaign to recognize and thank our public health heroes. With Richland County's Emergency Operations Center now stepping down the Incident Command Center, now seems like an appropriate opportunity for the county to recognize our own local public health heroes who helped our citizens get through the difficult time. So what would be proposed here is giving really kind of a recognition bonus to those individuals based on the level of involvement that they had over this 2-year period. Yesterday, we heard from the Division of Public Health that our allocation could be used for this purpose. So we would not actually be asking to use those American Rescue Plan funds that are set aside right now for public health response. I'll scroll here to the financial review. So the cost of doing this, it's a fairly modest bonus that we're proposing, anywhere from $2,000 bonus for that 2 years of commitment that staff made, down to $500 depending on kind of that level of involvement because staff participated at different levels. And then we'd also like to really provide commendation plaques memorializing that contribution. So these $44,500 would be drawn from that public health allocation that we receive in order to do this. You'll see that we have an attachment that shows how we came up with trying to identify a bonus structure that would recognize those contributions. So more than 500 hours, and I will tell you that when you combine our 3 public health nurses over the 2 years, their combined hours that they put in added up to, I don't know if Rose is still on here, but I think 4 additional full-time FTEs because of all the nights and weekends that they worked over the course of the 2 years. So $500 was kind of where we drew the line to just make a recognition of our staff who made significant contributions, but I will let you know that for many staff, it was many more hours than that. This bonus structure lists those 33 individuals along with the public health work that they did. So everywhere from our actual public health nurses to all of our staff, not just health and human services. It would include staff from the ambulance and emergency management. We do have some staff who are still with the county, but now they're working in other county departments. Many of our admin staff and staff from our other program units volunteered to work extra hours to do some of these activities. And so you can look through the list to just see the different kinds of roles that staff played. So that would be my summary of this issue, Mr. Chair.
Did you scroll down through the list there?
Sure. There's 2 pages here. So what I did was I listed the higher level bonuses and then alphabetically. And then on the second page, you'll see that there's a $2,000 level and a $1,000 level, and a little further down, you'll see a $500 level.
Okay, we heard a proposal. What is the committee's wishes? I would move for approval to send this on to finance and personnel. There be a second?
I'll second.
Seconded by Dr. Barris. Any further discussion?
Mr. Chair,
Go ahead.
Tracy, just to be clear, this funding source is not included in the prior items proposal, correct? This 43,000.
That's correct. That's
okay.
This is strictly funding that we have available to us now.
Perfect.
Okay, any further discussion? Any more discussion? Hearing none, all those in favor signify by saying aye.
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 Aye. Those opposed say nay. Motion carries. Director Thorson, so we have a board member that's gonna have to leave here at 12 o'clock. Do we got anything that's like important that needs to be approved yet? Or should we just
Definitely
continue
the
on?
next agenda item, and let me just kind of look down. The next 2 agenda items are probably the most significant that do need to be addressed if possible.
Okay, then let's move on to agenda item 12 then. That is to approve and eliminate early intervention special educator position and replace it with the children's long-term support birth to 3 case manager position.
Correct. So if you remember, in February, we talked about how the birth to 3 and children's long-term support caseloads are higher than the state average. So we figured out with existing funds that we could change an existing position, the early intervention special educator position, over to a children's long-term support and birth to 3 case manager position to cover those caseloads. And that would give reduced caseloads from 45 to 49 consumers or clients served down to about 32 an average client served. If we changed one of the existing positions that hasn't been filled by a qualified staff in approximately 10 years into a position that we believe would be able to be filled by a qualified staff. And it replicates, and we already have another staff that serves in that children's long-term support and birth to 3 case manager position. In addition, it would change the current position that's on the books from a 35-hour-a-week position to a 40-hour-a-week position. And again, this would be fully funded through existing funds through CLTS case management waiver funding, children's community options case management funding, birth to 3 Medicaid case management funding, and then CCS or comprehensive community services funding. So we are requesting to eliminate the position in place and with the eliminate the early childhood special educator position and replace it with a CLTS and birth to 3 case manager position.
And Mr. Chair, I'd like to just add to what Miranda said, that by eliminating the one position and creating the second position, it allows us to capture more revenue because it's billable in ways that the first position would not have been. So by trading these two positions, it allows us to fully fund a needed case manager position for these programs.
And that other position that we're eliminating, we weren't able to bill at a higher rate. Is that what I'm gathering? Yeah.
That's correct. That we weren't able to bill it in some of the programs, and as well, we aren't able to find a staff to fill that position, a qualified staff to fill that position. Additionally, to meet that need of the educator, we are able to contract with local school districts or CISA to have an educator on the birth to 3 teams in a different way.
All right, we heard the resolution proposal. What is the board's wishes?
I'd move for approval.
Motion by Timothy Gotchel. Is there a second? Seconded by Cindy Chicker. Any further discussion?
Mr. Chair,
Go ahead.
Tracy or Miranda, is the current educator role in the 2022 budget? Have we budgeted for it, I should say?
No, we did not.
Okay.
It's not in the budget. However, we know that how we will recoup the funding, that by adding the person to do the billing for the services, that we'll be able to more broadly serve the population that needs it. And that billing will cover the cost of the position. But yes, it was not included in the budget.
Okay. I understand that. I think we all understand that. That's going to be a, particularly with the 2 other items that we're taking to finance, that may be a sticking point that we'll want to make sure that we clearly convey to finance.
Yes.
We do have a narrative page as well. Stephanie wasn't here today and we debated whether to share it or not, that shows the funding sources that would fully fund the position.
Perfect.
Any further questions? Hearing none, we'll call for a vote. All those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. Next on our agenda is agenda item 13, approve new Commission on Aging and Disability Board member.
Yeah, so we had the COAD board approved for Larry Engel to fill a vacant position that was vacated by Patrick Manning. So they approved, the COAD board approved him. And then we also had Cindy Riley, who was representing individuals with mental health issues. She has termed out, and so we have Angela Metz that was approved by COAD yesterday to fill this position. So just need the board's approval to move that forward.
Was Angela filling another role somewhere else at one point in time or no?
She used to be on our transportation coordinating committee.
Okay. She's not on there anymore?
No.
Okay. You heard the proposal. What is the board's wishes to approve Larry and Angela?
I'll move to approve.
Motion by Dr. Barris, seconded by Cindy
Cindy
Chicker.
Gatchell, yeah.
Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. Next on our agenda would be recognition of van service.
Mr.
Not
Chair, even
here.
though, oh, I'm sorry.
Go ahead.
I was just going to say, even though Supervisor Nelson isn't able to be present at the meeting. I do want to thank him for his service, both to the Health and Human Services Board and the Commission on Aging and Disability Board. I know he, especially on the COAD board, he was a very active member, and he's been a really good supporter of the programs that we provide. And just want to express our position, our appreciation on behalf of the agency for his service.
Very nice. Thank you, Van, for your service too. Agenda item 15 is Health and Human Services Citizen Member, Board Member Recommendation. Was
Mr.
everybody given that letter that was sent out by Clint, or?
Yes,
That just
Mr.
me.
Chair. All of the Health and Human Services Board members should have that. It was an email that was submitted to our county administrator by Lee Van Landite, related to his interest in serving on the new Health and Human Services Board with, I think, because we have the vacancy. So I know some things will change with the restructuring, but I guess I wonder if it's appropriate for the board to make any kind of endorsement of that. I think that's what we're bringing forward to you.
I think that's up to the county administrator, isn't it?
Yes, and as I understand it, you know, certainly the county administrator is the one who will appoint people. And as we talk a little bit about the new restructuring of committees, I can share a little bit of what I know about what will happen with our Health and Human Services Board. So I don't know if it requires action, but the board should be informed that interest letter did come forward.
Yep. You can go ahead then with that on, what is it, agenda item 16?
Sure.
You kind of loop that all into one, I guess.
All right. So I've got a couple of items in your board folder, just showing where I believe we stand. So on March 30th, the county board adopted a resolution making changes to the county board rules, the management policy, and the committee structure. So a new Health and Human Services and Veterans Standing Committee is going to be created following the organizational meeting. This is now written into the board rules. So what we shared with you last time is pretty close to what ended up getting approved. So there will be standing committees, 9, I believe, then there'll be, I guess, 2 sort of executive type committees, a Finance and Personnel Standing Committee and a Rules and Strategic Planning Standing Committee. So all of these, any finance or personnel related issues will go from one of our standing committees up to the Finance and Personnel Committee. If it's rules related, I believe it will go there, or there may be some issues that just go directly to the county board. So with this is the creation of a Health and Human Services and Veterans Standing Committee. This new committee will consist of 11 total members, including 6 county board supervisors and 5 citizen members. Of the citizen members, 3 will need to meet the requirements of Health and Human Services, including a physician, a nurse if possible, and a person who has received human services or has a family member who's received human services. And then the other 2 citizen members are to be veterans. In these standing committees, they will vote on their chairs and their vice chairs like we have in the past. And then we'll also choose who they want to represent them on those executive type standing committees, the Finance and Personnel Committee and the Rules and Strategic Planning Committee. So Health and Human Services and Veteran Standing Committee will have a representative on each of those other committees. And that's how those committees, I believe, will be made up. I believe what happened at the county board meeting is that all the committee term limits will be reset, and those that currently have staggered term limits will be preserved the way they are. The county administrator plans to reappoint our citizen committees to the new standing committee as long as they want to continue in their roles. He has proposed a committee schedule in order to help streamline how actions can progress from standing committee through any required approval process, like going to finance and personnel and then on to county board. Just going to switch. That would, if, you know, it's really up to the committee to decide when to meet. And I think the county administrator has pointed that out. But if the committee were to meet on the first Thursday of the month, that would, I guess, set things up if something needed to go to either finance and personnel or the rules and strategic planning committee. It could go that next week and then get to county board the following week. So the timing of that flow is the intention of creating a schedule like this. I don't know what this will mean for this board because it'll be a whole new board really overseeing 2 county departments. And it will be up to that board of course to decide when to meet, but that I wanted to make sure I shared with you that proposed schedule. It's certainly the county, nothing was officially passed related to the schedule. I think that that is being left up to the committees to determine when is best for their membership to meet. Mr. Chair, do you have anything to add? I know you were, well, all the county board members perhaps maybe have something to share as far as this, if I've missed anything or if you think something isn't right or if there's anything more to speak to related to this.
I have nothing. It'll be interesting to see how this unfolds. I served with Cindy on the Parks Commission and they were briefed about how Parks and Fair are now combining together. So like the only one here that probably had some confusion or maybe questions would have been Dr. Barris. I don't know. Do you have anything?
No, not really.
Okay.
I guess
Yeah.
it would-
So
maybe-
I guess county board is meeting on the 19th of April. So next Tuesday. And your presence is requested there. So when we're going to be in county board, we're going to vote for a county board chair, county board vice chair, and then we're going to break into several different committees. And then we're going to call those committees to order. And that's when we're going to elect our chair and the vice chair, and those delegates. So being a part of that on April 19th is probably important if you want to say who your chair and vice chair is going to be. I do believe that the chair has to be a county board supervisor. Last I checked an email from Clint and Michael Lindell that the vice chair could be a citizen member. Just that the delegates, the 2 delegates have to be a county board supervisor to be on the finance and personnel and the rules and strategic planning. Anybody have any other questions?
You know, I hadn't really thought about this, Mr. Chair, but I guess I wonder if those committees are going to meet on the night of the county board meeting. I wonder if we want to try to have somebody there to take the minutes for the Health and Human Services and Veteran Standing Committee. Probably it might make sense for me to reach out to the Veteran Services officer to kind of coordinate how we would do that. And kind of maybe have a plan at least to assure that if that committee convenes, there should be some minutes for it, I guess.
Yeah, that would be great. You could do that. I didn't think of that either, but yeah, it would be good to have somebody take some notes and minutes for us.
There is a department head meeting this afternoon, and I guess what I'll do is maybe the county administrator has kind of thought about that and really has a plan for it, but I guess just occurred to me to mention.
Okay, also, I guess just to be aware, so now that we're gonna be providing some oversight and policy on how the Veterans Office, the Veteran Service Office is now being operated. So that's gonna be a new thing to this board that we're gonna have to oversee now is the Veteran Service Officer and her employee or future employees. I don't know if she's got one yet, but. And then I think the Veteran Service Commission also does look at the funding and how to provide funding to area veterans that are in need and how they can also be part of the Veterans Affairs healthcare system with that, plus some other things too. So I guess that's all I got. Does anybody else have anything? Tim?
Carrie, the current Veterans Service chair is not seeking re-election, correct?
Correct, and that is Lee Van Landite, and he just submitted his letter of interest to be on the Health and Human Services and Veterans Standing Committee. But there is Don Seep, who's a supervisor, who's also a former HHS board member. I think he's on veterans. I'm sure he's probably would like to be back on this committee too. And then Van Nelson was the other supervisor that was on veterans, but he's also resigning. So I think there might be a couple people from that committee, maybe some new faces on our Health and Human Services Board.
Can I ask a question?
Sure.
Is this change in shift of potential schedule, and I know everything's going to be kind of clarified on the 19th, but looking forward, is it our meeting going to be on the 5th of May then? Is what they're targeting? Which is like literally the next week after the 19th that we have to put everything out and get it. It's just,
Yeah.
if that's going to happen, it's a real quick change.
Well, I don't know what the future is going to hold out for who's going to be on the committee and who's going to do what, but I guess my recommendation would be try to keep it the same, I guess. I don't know if we can now. I guess it's all going to have to depend on when Finance and Personnel is going to meet. Otherwise, we'll be like fair and have to wait a month before we get anything done.
Mhm. Yeah, so May 5th or May 12th could be our board meetings, our next board meeting, just to let you all know, kind of prepare for both.
Yeah.
I
Yeah, it's all
didn't
gonna-
hear that we're not doing this till June, I guess, was it's supposed to happen in May.
I think there
It's
will
going
be
to happen
a
on the
meeting.
19th, and then whenever they decide on when they're going to meet is when they're going to meet. And then I guess we all got to flow around whenever Finance and Personnel is going to meet.
Okay.
Unless we
Terry-
want to really strategically plan and bring stuff like 2 months ahead of time in order to get stuff there, which I don't think that's possible. Go ahead, Dr. Barris.
Is the meeting on the 19th, is this all in person or is it also going to be on Zoom?
It'll be both.
Both?
But I think it may be, I don't know how we're gonna break out into committees, whether we're just gonna do it generally, or we're gonna
One
break
at a
off and
time.
go to a corner of the banquet center and convene and open up. I don't know. I think the best bet would probably be to attend in person. I think Zoom or WebEx will be available. One of those two will be available.
That's posted somewhere as far as how
Yep,
to do it?
yep. Be posted on the county's website at the courthouse. And you should be getting a packet in the mail, I would assume, or a letter
Okay.
from Clinton Langrick. You should be getting one of those informing you of the upcoming meeting, your request to be there.
Yes, I did offer all of the citizen members on this board their mailing address information as well, but maybe this afternoon, Tracy, we could clarify. Clint, I gave him all of the other subcommittees of this committee's citizen members, everyone that's on those membership lists, but I did not give them, they didn't ask for mailing addresses or emails or any contact information. They just asked for who they were. So I don't know how they're notifying everybody.
I don't know that there's a need to notify those subcommittees,
Subgroups.
but yeah, yeah, we'll ask that when we have the meeting this afternoon.
All right, any last questions? Thank everyone for attending these last 2 years at this Health and Human Services Board meetings that we've had virtually, majority of the time. It's been interesting and unique. Thank you, Tracy, for leading us through, and Rose for leading us through our difficult times that we've had last 2 years. So it's been a joy. All good things got to come to an end, I guess. Anybody willing to make a motion for adjournment?
I so move.
Motion by Cindy. Is there a second?
Second.
Seconded by Timothy Gotchel. All those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. I hope to see you, most of you, on May, whatever date it is. Bye.
Thank you.